Hi, my name is Jordan Samuel. I'm currently in my third year as a mechanical engineering student at the University of Alberta. I'm here today to talk about an exciting innovation that I feel will change the world for the better. Innovation, by definition, is the introduction and improvement of new ideas, devices, and methods. For me, the first thing that came to mind was robotics and their integrated use in society. The area of robotics is very broad and has endless possibilities in what can be achieved. From the first simplest forms of robots to the advanced level realized today, we have made great strides in innovation. But this is only scratching the surface of what we're on the brink of accomplishing. Now, specifically, the area that I'd like to discuss is that of robot-assisted surgical operations. To begin, I'll give a brief background on modern surgical procedures, followed by how the integration of robotics can improve these, and lastly, touch on some future possibilities. The area of medical sciences has improved exponentially over the past century. In the past, surgeries were only done as open surgeries. This is done by creating a large opening so that the operation can be viewed directly by the surgeon himself. This is not an ideal approach. It is very invasive, with it being such a large incision, and causes for longer recovery and leaves large scars. The large incision also increases the risk of damaging nerves when cutting through. As well, it is not as efficient and is more prone to errors at the hands of the surgeon. Nowadays, when possible, a technique known as arthroscopic surgery is used. It is a much more preferred method. It essentially utilizes a number of small incisions as opposed to a large one, and the use of a small camera being inserted through one of these incisions to be the eyes of the surgeon. This allows for the work to be viewed and completed efficiently without causing too much unnecessary disturbance. The unsteady hand is still a factor, though this is a much less invasive process. Now, while this is preferred, both methods are still held back by the stability, mobility, and accuracy of the surgeon. With the involvement of robotics, the shortcomings of conventional ways can be remedied. The technology has already been brought to life by a company known as Da Vinci Surgery. They have developed what they call their Da Vinci Surgery Systems. These advanced robots are capable of performing an increasing number of operations with extreme precision. The robot is fitted with multiple arms and attachments and can perform surgical tasks while being controller operated by a surgeon. The surgeon is actually at his own little station with the controls and is still completely in charge of what is happening. As with normal arthroscopic surgery, it is minimally invasive, needing only a few small incisions and providing internal view with a tiny camera. The camera provides a 3D view of the operation site. Now, where this technology truly shines is in its precision. As a robot, it can provide extremely accurate movements due to its enhanced stability and control. This allows it to be able to perform extreme difficult maneuvers. It gives surgeons an added level of dexterity and increased range of motion. This aids in reducing all kinds of errors. The future is very promising for this area, as it is always improving. It is hoped that one day this technology can be harnessed in a remote fashion. There can be centers for patients to go to receive operations locally. The surgeon won't even have to be present. The goal is so the tasks can be performed remotely, whether that be across town, across the country, or even on the other side of the world. This technology will provide society with a more attainable service than what is currently in place. It will reduce the need to travel to visit the facilities and specialists. I believe that with further development, robot-assisted surgeries can be a commonality.